Hey, you are listening to Medica Talks, which brings to you all the exclusive healthcare industry news, views, and opinions from across the world.
Hello listeners, I'm Urvashi. Today we will discuss venous thromboembolism. Hello doctor, welcome to our podcast for patients, caregivers and healthcare professionals at Medica Talks. Doctor, what is venous thromboembolism?
Hi Urvashi. VTE is a term used to describe both deep vein thrombosis and pulmonary embolism, disorders caused by thrombus formation. All patients being admitted to the hospital or undergoing surgery should be assessed for VTE risk on admission and reassessed within 24 hours or if a change occur in the clinical situation. VTE is one of the leading cause of preventable death in hospitals and is an important topic for junior doctors to understand.
Quite interesting. What are the risk factors of venous thromboembolism?
The formation of thrombus in a patient is dependent on abnormal blood flow, usually due to recent immobility such as a long distance flight or being bed-bound in hospital. This is the most common underlying cause of DVT. Abnormal blood components can be caused by multiple factors such as smoking, sepsis, malignancies, or even inherited blood disorders. Example, factor V lead-in. Abnormal vessel walls can be formed, arthrioma formation, inflammatory responses, or direct trauma. The main risk factors for developing a venous thromboembolism includes increasing age, previous VTE, smoking, pregnancy, or recently postpartum. Recent surgery, especially abdominal surgery, pelvic surgery, hip or knee replacement, prolonged immobility, hormone replacement therapy or the combined oral contraceptive pills, current active malignancies, obesity known as thrombophilia disorder.
Oh, that's quite interesting. What is deep vein thrombosis?
A deep vein thrombosis refers to the formation of blood clots in the deep veins of a limb, most commonly affecting those of the legs or pelvis. The most common presenting symptoms of a DVT is unilateral leg pain and swelling. Other symptoms include low-grade pyrexia, pitting edema, tenderness, or prominent superficial veins. Importantly, 65% of DVTs are asymptomatic. If a deep vein thrombosis is suspected in a patient, the DVT Wells score should be calculated. Score less than or equal to 1, DVT is clinically unlike. Score greater than 1, DVT is clinically likely and DVT diagnosis should be confirmed via ultrasound scan or a contrast venography.
How to manage DVT?
Direct oral anticoagulant, that is DOACs, are now recommended as a first line treatment for DVT. Caution is advised in those with chronic renal impairment or if taking potentially interacting medications. Anticoagulant treatment should be continued for 3 months in those with provoked DVT. However, in those with a proximal DVT and a persistent risk factor or high risk of DVT recurrence may require lifelong anticoagulation.
What is pulmonary embolism?
A pulmonary embolism, that is PE, is a blockage of pulmonary artery by a substance that has traveled there in blood streams. Most commonly, this blockage is a thrombosis that has broken off and migrated. Such a form of DVT other cause includes a right-sided mural thrombus, atrial fibrillation, neoplastic cell, or from fat cells. PER, sudden onset dyspnea, paralytic chest pain, cough. If pulmonary embolism is suspected in a patient, the PE well score should be calculated. Score less than or equal to 4 is PE clinically unlikely. Score greater than 4 is PE clinically likely, and PE diagnosis should be confirmed with a CT, pulmonary angiography, scan in those with poor renal functions.
What is thromboprophylaxis?
An important part of management of VTE is prophylaxis. Prophylaxis is typically continued until the patient is no longer considered to be at a significant risk of VTE. All patients undergoing surgery should be offered mechanical prophylaxis. Unless otherwise contraindicated, mechanical prophylaxis should not be used in patients with peripheral arterial diseases, peripheral edema, or local skin conditions. There are two main methods of thromboprophylaxis used in hospitals. That are mechanical thromboprophylaxis, anti-embolic stockings, intermittent pneumatic compression, more commonly used in theaters. Pharmacological thromboprophylaxis, low molecular weight heparin, that is LMWH, unless poor renal function.
So, doctor, what message would you like to give to our listeners?
Venous thromboembolism is a large cause of preventable death. VTE risk assessment should be done on all patients. Patients at risk of VTE should be commenced on appropriate thromboprophylaxis. Patient with a confirmed VTE will require prompt treatment with anticoagulants.
Thank you, doctor, for being a part of Medica Talks and sharing your insights. We are hopeful that this informative talk has enlightened our listeners and has provided the necessary information on VTE and how doctors can take care of their patients post-operative.
Hey listeners, I hope this podcast was beneficial for you. Don't forget to stay tuned with us for our next podcast session, where we bring to you all kinds of healthcare industry news, views and opinions from around the world.